Hey everybody, William Wallis for America here. Thank you so much for tuning in today. And today I'm in the office of Beryl Amedee, State Representative for Louisiana, District 51. I'm going to bring her on in just 1 second. As you can see her sitting here, you'll notice on her desk, we got the camera slightly offset because we like to have the pro-life symbol over there and some other things. You can take a notice there, and you can keep an eye on the window in the back and see if you see anybody pass around here you might know. Of course, it's a joke. But either way, I'm going to bring Beryl Amedee on. Beryl, thank you so much today for being on the show with me.
My pleasure.
I really appreciate it, some time. And today we're going to talk about some issues that are really hot to talk about right now, which is to mask or not to mask, to vaccine or not to vaccine. And we think it's really important to be able to have not only people's personal views on this, but also an elected official's views of what's going on within government, so people can feel more comfortable about whether they choose to mask or not to mask, and kind of understand things are going on right now. So, well, Beryl, let's first give the public a little bit of a view on where you stand. What's a little bit about you and your district first.
Okay, sure. My district is House District 51, and that covers portions of Terrebonne, Lafourche, Assumption, and St. Mary. And this is my 5th year in the legislature, so I've served 1 term. This is the beginning of my 2nd term, and it's been quite an adventure. Never a dull moment, always something new to learn, so I can't say I ever get bored. Tired maybe some days, but not bored.
And I do want to point out, as we talk about this, we sit at each other at an angle here, so that way we're not talking into each other's face, so we can kind of social distance a little bit for the video. But Beryl, where do you stand on, I guess, a little bit about you? Education, I think, is a hot topic, but also freedom and liberty. You had something you said before we got on camera about that.
Yes. I came into this position already having worked for years on certain freedoms and liberties. As a homeschool mom years ago, whenever my children were old enough that I could go to the Capitol during the legislative session and they could still get their work done without me sitting right next to them, that's what I did. I was at the Capitol very often. Anytime someone was presenting a bill that would challenge homeschool freedoms, or maybe a bill that would enhance homeschool freedoms, I would be happy to go to Baton Rouge and spend some time speaking with our legislators on behalf of homeschoolers. And while I was there, I found that there was plenty going on that was really interesting to me. So I stuck around, and I was working just as a volunteer member of the public to support things like parental rights, religious freedom, smaller government, and just personal freedoms. All of especially our constitutional freedoms. And it's been so fun to me to do that it's a joy that I get the opportunity. It's really a blessing that I get the opportunity to serve in the legislature now. So instead of going to the Capitol to speak with legislators, now I'm one of them. So people come and want to speak with me, and that's really a joy of mine to be able to serve the public in that way.
So your community service goes way back to, you could say, to when you were basically just a regular citizen, trying to bring the voice of people to the legislature, on your own interest and your friends' interest, and now you actually get to fight for their interest as an elected official.
Yes, and I just feel that if I only have so many hours in a week that I can work on civic duties, it's great to have the opportunity to work at this level, because now I can actually take the good ideas and turn them into bills and present them, and hopefully get some laws passed, or maybe some bad laws taken away.
Right.
So it's just a front row. It's not even front row. It's kind of like going to the football game and you actually get to be out on the field and you get the ball every now and then.
I love it. Yeah. and sometimes you get to take and run with the ball, right?
Yes. That's always an adventure.
Well, there's a lot going on that we've seen in the legislature up to now, and especially this next session is going to be huge, because I think it's more budget related this next time. But there's still that same lingering thing from the last session, which was shutting down the businesses, whether they mask, not mask. Should businesses have the right to be shut down by our government? You brought up the Founding Fathers, constitutional rights. So I know you stand on freedoms. How do we balance between to mask or not to mask, vaccine or not to vaccine, between people who either don't believe in it or people who want it, and then government having the right to shut it down or not? How do we balance that?
Well, the rights of the government, or the authority of the government to be able to do many of the things that we've been seeing for the past year, are questionable. And that's why, even as we speak right now, there is a lawsuit in Louisiana between the governor and the legislature concerning the continuing emergency health mandates. And so whether or not the government has the authority to do what the government is doing at both the state and the federal level is questionable, but that's an issue for the courts to figure out. As individuals right now, we're faced with a lot of decisions that we have to make. As we're under these health emergency orders, businesses right now in Louisiana are expected by our governor to help enforce a mask mandate by saying anytime a customer comes into your place of business, you are expected to require them to wear a mask. And if they don't, you're expected to take certain steps. And so as individuals, we each have to decide every day what we're going to do. Whether or not you're going to wear a mask all day and under what circumstances. And there has been so much going on in the last year that's divisive in this country, politically divisive, and here we're faced with health questions. And so what I'm hoping to do is to help people to understand that there are two sides, and that every individual has to make their own decision, and that we should not hold other individuals who might make a different decision than ours as evil.
Right, I like that. Right.
Yes, they're not making their decision to threaten the other person. Someone who does not wear a mask and walks past me is not doing so in order to endanger me. And if I feel that they are, then that might make me want to be aggressive towards them. That's not going to lead to anything good.
So it's almost respecting each other's personal freedoms.
Yes.
You know, like I was at a gathering recently, and there were some people in the medical field, and they had said, you know, that while they believe that people should get the vaccine, you know, they also believe that it's a personal choice or personal freedoms of people to be able to choose whether they want to get a vaccine or not. And even though them being in the medical field, they respected somebody's personal choice or personal freedoms on whether they were going to get a vaccine or not. So you're kind of saying that maybe government should kind of have that own value, I guess, to respect people's freedoms.
It would be wonderful if government would practice respecting our freedoms. It seems that a lot of what we've seen in the past year or so has been questionable, in that we're getting mixed messages as it is. If you can remember, last year, around February, March, we were hearing from the experts, from the medical professionals, from people in high positions of authority, both in the medical and the political communities, and we were getting mixed messages, sometimes from the very same entities, just a couple of weeks apart. You remember, at one point, we were told by the authorities, the general public does not need to wear masks. It's not going to be effective. It might even take away from the amount of PPE we have available for the medical community who deals with people on the front lines and needs the mask to do their job. And then a few weeks later, we were told, well, everybody should wear a mask. But then we were told that this virus is so small, it passes through most every kind of mask except maybe the ones that are made specifically for surgery. And then we were told, well, when the virus is airborne, it has connected itself to other things, fluids and such, so that it won't really pass through the tiny holes in the fabric of them. So it was just so difficult to keep up with. And so everyone would need to do their own research, study it, make their own decision. And then we found out that a lot of the information was being kept from people, because if anything was posted online anywhere that didn't directly line up with whatever the medical establishment was saying this week, it was taken down. And so how are we even supposed to do our own research when half of the information that we might want to look at and consider is difficult to come by?
I like what you're saying there, but and I also like what you said a few minutes ago, connecting the two, which is it comes down to about freedom. You know, if somebody feels comfortable, they should be allowed not to have to wear it, and somebody should respect that that their freedom if they choose not to, just like somebody should respect the fact if somebody wants to wear it. But when you get the government involved, like you said, it becomes convoluted, which is a good reason for less government and the promotion of people's freedoms. Let people make that choice.
Yes,
Yeah.
yes.
What do you think is the best way to kind of to navigate this, if you will, that doesn't hurt our economy? Do you have a plan that maybe maybe government should follow or be more respectful of?
Oh, absolutely. First of all, why is it that we're really not hearing much of anything? If you watch the mainstream media, why are we not hearing about ways to enhance our own immunity? Where is all the health information that talks about what we should be doing so that we are less likely to catch any illness? COVID aside, any illness.
Yeah.
If you want to know that, you actually have to go dig for it. That's not being promoted in most of the media releases that I see, and in most of the public conversations, the videos, the news clips. We're not hearing about the things you can do. We're not hearing about how you should really get enough rest. You should really be sure that you have the proper nutrition. There was a meeting of House Education and House Health and Welfare. It was a joint meeting last year. I forget if it was in the last session or the one before. But I specifically questioned one of our medical people who had come to testify in committee about vitamin D. See, at that time, we were noticing already that many of our nursing home residents were very susceptible to coronavirus. And so one of the ways that you can boost your immunity would be to be sure that your vitamin D levels are up to par.
Right.
And so I simply asked this gentleman whether or not anyone's looking into that. Has anyone even considered testing the vitamin D levels of our most vulnerable population here?
Right.
And I wasn't really happy with his answer, because it seemed that he was saying that it really doesn't make any difference and it's not important. Seems to me that boosting your immunity so that you
Right.
can not catch this virus that's so easily passed around is very important, and I'm very disappointed that we're not hearing more about it. So that's one thing we can do. Another I would like to see promoted is, if you are part of the most vulnerable people who are most susceptible to this particular illness, then you should be encouraged to take all the steps you can to protect yourself. But for those who are not necessarily easily susceptible to this, for the younger, healthier people who don't have all of the risk factors, they really should be allowed to come and go and work and do their daily
Right.
routine and act normally in the community, because that's where we're going to be able to get closer to
Herd immunity. Right.
what they all talk about. And it should be a more real, solid, and lasting immunity than what they're promoting through the vaccine. It's important to realize that even the health experts right now who are promoting the vaccine.
We're ready.
Okay, so it's important to realize that even the health experts are letting us know that the vaccines, the two that are on the market and being given right now, do not actually keep you from catching COVID-19. And they don't stop us from being able to spread COVID-19. So for those people who are deciding that they want to take the vaccine,
Right.
they have to realize that this is not foolproof. It's not 100% protection. It's only going to hopefully reduce your chances of catching the illness. And what they're saying is they believe that if you do catch COVID-19 after you've had both doses of the vaccine, that it should keep you from having such an extreme case. Your symptoms should be lighter. So this is what the effort's all about. It's not about protecting everyone from the virus. It's simply about the attempt to reduce the harshness of the virus on those who do end up catching it. And so for many people, that's not a risk that they feel they should take in taking the vaccine, because the vaccine is not without the potential for side effects. There are adverse reactions. Some have been reported. We've heard stories, even on the news,
Right.
about there have been people who've passed away after getting one or both doses.
Mhm.
There have been people who've had some very extreme reactions that we don't really know yet whether their condition is going to be permanent or not. Things varying from partial paralysis
Right.
to, I mean, some of these...
I've seen the videos of people that have taken it, staggering and not doing well.
Yes.
But that's where I guess people have to research for themselves to find out, do the risk outweigh the benefits or vice versa, and just like we talked about with masks, having to respect somebody who chooses to wear a mask or not wear a mask, it's also about personal freedoms on whether they want to take the vaccine or not take the vaccine. But when you talk about, how the vaccine doesn't really stop the spread, you can still spread it to your loved ones, then I guess the question comes up, it talks about that you take the vaccine to protect your family, but how do you protect your family if you can still spread it even after getting the vaccine? Yes. So that's something to consider. And then with all the new different strains coming out, we haven't even gotten the full vaccine for the first one yet, and now we have 2 or 3 strains come out. It kind of goes back to what you're talking about. Maybe some of this money that's being filtered back into the community should be used to help talk about prevention and start talking about what people can do to even from getting it, because that in itself helps, I guess, immunity also, correct?
Right. Or how about this? If you boost your immunity and you're living in really good health, even if you get the virus, your symptoms should be more mild. You should have an easier time overcoming it. Now, there are always going to be those cases that nobody can really explain. Why did this 35-year-old in the prime of his life, no health conditions that we know of, perfectly healthy, exercised, ate right, and all that, picture of health, he caught it and died? Well, yes, that can happen.
Right.
But how about the 95-year-old in a nursing home who caught it and lived? I mean, there are just no guarantees here.
So it's almost like there's no guarantees whether there's a vaccine or not a vaccine, that sometimes it can go either direction. So it goes back to, personal freedom of doing everything you can to prevent it.
Yes, and this is why it's so disheartening that it's been drilled into our heads over months now that we were waiting for this vaccine. We need this vaccine so we can get back to normal, right? Well, how are we going to get back to normal when this vaccine that we've all waited for does not necessarily keep you from catching COVID or keep you from spreading it? So does that mean that we're not going to get back to normal, at least not anytime in the foreseeable future? Especially
the new strains.
Yes, and we've got new strains coming out, and we don't know whether the current vaccines are going to protect against the new strains or not. So it seems that this vaccine may be more like the flu vaccine, where it's going to have to change and adapt every year, and they're going to have to select the one that they're going to give this year based on the strains that we're seeing. Right now in Louisiana, 30% of the population gets the flu vaccine on a regular basis, just 30%. Right now, with the COVID vaccine, in the hospital district that I represent most of, it's been told to me that only 22% of frontline medical workers are willing to take the vaccine.
Only 22% are willing to get it?
Yes, that's medical workers. That's why they're saying they think that people should make the decision for themselves, because they themselves want to make the decision for themselves, for their own bodies and their own families. Only 30% of the staff in nursing homes is willing to take the vaccine. And so when we hear that, the next thought is, are government mandates coming next? Is the government going to have to demand that everyone take the vaccine, or maybe that frontline medical workers and nursing home staff take the vaccine? What about schools? I'm hearing rumblings that in certain states, the school staff is refusing to go back to work unless the government mandates that all the students get the vaccine. Now we're talking about children. Children who are known to not be the ones who pass the vaccine easily, right, or who even catch it easily, or when they do, many times they don't even have significant symptoms. And yet there are some who are going to want to mandate that students get a vaccine before the teachers will go back to the classroom. So yeah, it's getting really difficult.
And when you start navigating that, and you start navigating government dictating all of that and making the rules and regulations, then it gets into one of those things where who's committing a crime?
Yes.
If somebody has to get it but somebody doesn't have to get it, whose freedoms are they going to trample on more, and where does government overreach hurt our citizenry because, like we said, the vaccine, you can vaccinate a student who really doesn't get the effect from it, but you're vaccinating a child when they might not even be spreading it anyway, and if they do, or if they get vaccinated, they could still spread it anyway.
Right.
What in your opinion would be a good way for government to help without hurting our freedoms? Do you have an example of that?
As far as the vaccine?
Yeah, well, maybe as far as the whole COVID thing is related, do you think there's a way for government to respect our freedoms and respect our desire to vaccine or not, or mask or not, and still be able to help society in a way that it helps everybody?
Oh, yes. First of all, we still have as a basic principle in law that you cannot quarantine the healthy. And this is why we never had orders that mandated that we stay home and stay in our houses. We only had stay-at-home orders, which mean we recommend that if you don't have significant or legitimate business to tend to,
right,
please stay home and don't socialize. It's because that would be requiring the healthy to stay home, to isolate. We can't quarantine the healthy by law. So that's first. Let's not try. In fact, in many cases, the countries and the states that have never really shut down businesses and made people stay home so much are better off. They're doing better. They've had less cases, or they've had less harsh statistics, less deaths, less hospitalizations. So we really have to rethink whether all of the isolation has been effective. And I think the first place we can look is our nursing homes, because they've been so severely isolated for so long.
And what's hurting them worse, the risk of COVID or the risk of loneliness and the risk of not seeing their family in their later years?
Yes, and whenever truth can finally be told and we get real numbers of what actually has killed people, I believe that we'll find that somewhere fairly middle to late 2020, we will see that there was a shift, that we actually did have more of our nursing home residents passing away from the effects of long-term isolation than we did from the effects of or directly from the coronavirus itself. And I'm still waiting on those numbers because nobody's really counting them, nobody's really putting them out there. We still have numbers being reported to us of COVID-related deaths, not just COVID-caused deaths.
Right.
And so we have been given so many numbers, so many statistics that have been enhanced in such a way to legitimize some of the mandates. And it's unfortunate, because I think years from now, we will eventually find the true numbers, and the devastation will have already long since happened. We won't be able to go back and do much about it. We won't be able to go back and bring back those people that we lost due to the effects of isolation, and that's disturbing.
Right, because those, like I said, those results may never get reported, especially if there's all these future strains of COVID, because it's easier to use, I guess, the fear of what could happen to them than the reality of what actually happened to them.
Yes.
One's more powerful than the other. What is another way you think that we could help our communities? Is there another way that maybe it's we can always talk about state and federal guidelines, but what on a local level in our communities can we do to help each other out? You think is most important?
Well, I think number one is what we started talking about early in our conversation, and that is to respect other people who may be making different choices. If you're a person who desires to run out and get the vaccine, then please do so. If you're a person that does not want to take this vaccine, then please don't. But let's not attack one another when we differ in our decisions that we make. So that's first and foremost. Secondly, I think that we can all use a little bit of encouragement to pursue health. I mean, it'll do us all some good.
Right.
Who couldn't be a little healthier?
Yeah, exactly.
And I think we're still in January, so we're still in that time of the year where people have made those New Year's resolutions.
Right.
Stick with those.
Now's a good time to do
This
that.
Is a good
I love
time.
it.
So we should all pursue health, because we don't know what the future holds. We don't even know for sure what we're currently facing
Right.
with all of the data that's been coming out that can be misleading. So I don't believe anybody will ever regret pursuing health. I mean, I tell people, you have one body.
Yeah.
You're only given one.
Only live
and
one.
You have to live in it all your life.
Yeah.
So how about take care of it so that life can be comfortable for
Right.
you? Nobody plans to spend their days and hours doing things that are unpleasant, such as sitting, taking dialysis.
Right.
So if we take steps to try and avoid having health problems that are going to affect our daily lives and limit us, then I don't think anybody's going to regret that.
So sometimes practicing your personal freedoms also means practicing your personal responsibility, and not only being respectful for others in ways where, you say, okay, if you choose to wear a mask or you choose to have the vaccine, I'm okay, that's your choice, maybe not mine. But it also comes down to keeping yourself healthy. In a way, that's a way of personal responsibility for others also. And I guess if you've been exposed, wear a mask or not wear a mask. But the other thing I want to bring into it is government. It's almost kind of like not only have to be respectful of each other's personal freedoms and each other's decisions, but we also have to navigate the governmental laws that are and regulations that are coming out with it. So it's kind of like when a government says to a business, you have to make people wearing a mask. You don't want to walk in there without wearing your mask. It's almost like you be respectful of that business because they get fined if they don't wear a mask, or they get fined if they're not having people wear a mask, or they can get fined, But it also, people think that the government's just shutting people down randomly to control, but the government kind of needs that tax revenue also, or that business revenue. So government, are they kind of cutting their nose off to spite their face in a way?
Well, it seems that way sometimes. You would think that a government that exists on tax dollars would try not to do things that would limit tax dollars coming in. But some of what we're seeing has to do with the different levels of government. For example, many of the mandates that have been recommended are coming from the federal level. A lot of what our governor here has been following to some extent has been White House guidance. So that's coming from the federal level.
Okay.
Easy for the federal government to say to limit these things or shut down those things when that's not where the federal government gets its revenue.
Right.
By the same token, it's easy for the state to say shut down certain businesses or certain types of businesses when it's really the local government that gets most of the revenue from that. So local governments survive on property taxes, property tax millages, and sales tax. And that's about it.
Right.
The state relies on sales tax and franchise tax and corporate tax and income tax and so on. And so when the state says shut down a business, then the state might not be getting the income from the employees that were working there, but the business is still going to have to file its taxes at the end of the year. So all those the corporate and franchise and all that is still coming to the state. In the meantime, we have the federal government sending money down to the individuals. The federal government gives those extra portions of unemployment, for example. And so the money's coming from the federal government to help people manage to get through some of these closures. And so it's been interesting to watch what we're seeing as we come into this regular session, which starts in April. I've been looking into the budget that we're going to be facing, or the budget conditions that we're going to be facing. And there have been some interesting developments in that we know that we're going to be coming in with maybe close to $1 billion shortfall in state revenue. Close to $1 billion.
Wow.
However, when you look at what causes that, it's been directly related to a lot of what we went through last year.
Right.
For example, the state budget that ended in June of last summer, now that all the dust has settled and the bills have been paid, there's a surplus. Well, wait. Yes, it's a surplus. I had to make sure I'm using the right word, because there's surplus and there's excess. So the extra money left over from last year is considered a surplus. And constitutionally, we can only do a few things with that, but it's nice to actually have a surplus instead of old bills to pay after the fact. The budget that we are currently in right now, the one that ends this coming summer, we still have, it's not a surplus because the year's not over. We have an excess. It's a little excess. And I think it's just under $300 million in excess, if I'm not confusing the two numbers, but it's 200-something million.
Right.
So we have this excess, and so I've been asking, why is it there? Well, what we've discovered is a lot of that is there because of the CARES Act dollars coming to the state from the federal government, which, by the way, it's all our tax money anyway. It came out of your pocket, mine, and everyone's.
I might as well write the check to Louisiana.
Yeah,
right?
It's not magic money. I mean, yes, the federal government does print money, but it's still not magic. It's got to be backed by what's coming out of our pockets. So a lot of that is there because of the CARES Act dollars, which, by the way, are considered one-time money. Those don't continue every year. We can't count on those, so we can't use those to budget next year, which is why there's going to be a deficit. But some of that excess has been caused because, you remember the toilet paper issue?
Yes.
That no one can explain?
Yeah.
You know, why did toilet paper?
Yeah, why would we run out? Yeah.
Yes. Okay. What we've seen in the past year is that apparently under pandemic situations, people like to do two things that we really didn't budget appropriately for. They like to buy cars. So we have some excess because of automobile sales tax. And they apparently like to gamble. So we have some excess because we brought in more revenue.
You need those cars to go to the casino, drive the casino.
Must be. So now we know what people do. And honestly, part of that is because some people have received extra money like stimulus checks and extended unemployment. And so they have a little extra money. And so because of maybe they're feeling depressed from being isolated or not allowed to work, something that they consider fun to do is to go to a casino or play video poker or what have you. So you can see that's a reaction. It kind of, for some people, it wards off depression. It's a pleasurable activity, so there's been more of it. And as far as the cars, some of that may have come from the extreme the extreme hurricane damage,
exactly,
where people lost vehicles and had to replace them. But that doesn't explain all of it, because although the hurricane damage covered many parishes, it didn't cover the entire state. And so we can't say that everyone who bought a new car did so because they lost theirs in the hurricane. So
I guess maybe if you geographically see where the sales tax dollars are, where that came from, or what parishes they came from, you know, in the car sales, would be interesting to see, you know, how that correlated to the overall, like you said, the demographics of this money.
Yeah, so it'll be an interesting study in sociology to watch what has happened, what things surprised us, what things went beyond what we expected through this pandemic as far as human behavior. But either way, that's the budget that's coming.
So when they're talking about going into a budget, more a legislative session that's more budget oriented, coming out of COVID, you know, or not coming out of it yet, but coming from having a year of it, do you think that will help guide many elected officials on their decisions in this next session on how we spend our money, or knowing where to spend it, or knowing that based on new strains or, you know, freedoms and liberties of people and their businesses, you know, how we're going to navigate, you know, the next budget session?
I think it's going to be one of the elephant in the room, like they say.
Yeah.
We
need more elephants in the room, by the way. But
so here's what we do know. We do know that isolation, as we've practiced it for this past year, has not really solved the problem. We do know that stay-at-home orders haven't really solved the problem. We were often, as the general public, scolded during gubernatorial press conferences for not obeying, not staying home enough, not wearing masks enough. But I don't know, how much is enough?
Right.
And it seems that in some of the areas that had the most restriction, they also had the most illnesses. So it's going to be something that is in the whole, the bigger picture of the thought processes of what the legislature is going to do. I believe there will be a big push to do everything we can to continue to protect our freedoms and roll back certain government mandates because of what we've seen as the effectiveness or the lack of effectiveness. We were originally told, remember early on, that it was going to be 2 weeks to flatten the curve.
Now
we hardly even remember that.
Yeah, we're a year later almost.
Yes, we're almost a year, and we're still talking about the curve. And so if what we're doing is not what's working, then we might need to try something else.
That allows businesses to open up,
yes,
allows people to be a little bit more free,
right,
you know, allows personal decisions to kind of help, you know, because also the thing when you're always limiting people's freedoms and you're limiting their personal decisions, you're depressing more people.
Yes.
You're making people not as motivated to go out and be prosperous or be able to contribute to society in a way that keeps us going.
Right.
I mean, I can, how many times I go around, when I'm driving through the neighborhood, I notice rush hours are less trafficy. I notice there's less people out at restaurants. There's less, and all that brings an overall malaise to society that I think is going to affect our income and our state budget.
It does. It does. And I think that as we promote health, as we promote take personal responsibility, as we explain to people, if you are more susceptible, if you have more risk factors, then you take greater steps to protect yourself, and let the healthy people live life, because we just don't know how many more strains of this will come out. What if it's a whole new virus next year?
Right.
We just don't know. And so we have to make a choice. At some point, we have to make a choice where we decide, are we going to just live from now till eternity in fear, increasing fear, greater fear, because honestly, new viruses are discovered all the time.
Exactly.
Or are we going to live our lives the best we can and be as healthy as we can, and demand that the medical establishment quit ignoring and trying to hide or suppress treatments.
Right.
There are treatments on the market now that
Exactly.
existed last year.
Right.
And one by one, we've seen first the medical establishment rise up against these treatments and say, oh no, they don't work, they're not safe, don't you dare use them. Meanwhile, our loved ones are dying. And then finally, now, we're just now beginning to hear a little bit about, oh, well, that may work,
Yeah.
and that may work. You remember at first, they wouldn't allow any of the simple, affordable medications that had been on the market for years,
Right.
proven effective for what they were being used for, known side effects because they've been in use for years. They wouldn't allow any of those to be used. Instead, they treated people in certain ways. They ended up putting them on ventilators, and that had some dire consequences for so many people. And right now, that's not the standard treatment protocol.
Right.
That's sort of a last resort. Thank God.
Exactly.
But just in the past 10 days, I finally saw news breaking that, for example, ivermectin is
heard
now
about that.
allowed to be used.
Yeah. And is it famotidine?
I'm not familiar with that.
I might be saying it wrong. It's actually a medicine for acid reflux or for gastrointestinal stomach issues, and they're saying that even treats a little bit. I may have it wrong, so you have to check it out. But the one thing that we want to point out, is that we've tried to discuss, when we say mask or not to mask, or vaccine or not vaccine, or what things are out there, it's about personal choice, it's about freedoms, it's about our liberties. But it's also about doing your research and finding what's right for you, what fits for you, what fits for our community, and what fits for a personal decision, and do your research, because you might believe in vaccines, you might not, but you might have to respect others who disagree with you on that. But when you do your research, don't be afraid to be in touch with, elected officials and share with them, professionally speaking, so that way we can educate each other and help each other through this. Yeah. Would that be a good statement to say?
It is. And one thing that I didn't mention earlier was, as far as some people who are reluctant to take this vaccine, we have to remember that even the medical established community is not claiming that this is really a vaccine as far as the traditional vaccines that we're all familiar with. This is not a shot where they put a little bit of coronavirus in the syringe and inject that so your body reacts. This is a completely different kind of shot, and I guess I need to retrain myself to not always call it a vaccine.
Right.
Because instead, this is sort of a messenger that they put into your body so that it tells your body how it should react when and if it comes in contact with this particular virus.
I've never really thought about that. So it's not really a true vaccine.
Right.
Well, it's called one. It's more of a programming.
Mm-hmm. Yep. And so there have been some statistics that have come out so far that say things that are also concerning, and people need to know before they go and take the vaccine.
So pay attention to this, everybody.
Okay. So what I'm hearing from the medical community is this. Those who are elderly, when they receive this shot, are less likely to have so many extreme side effects as those who are younger who receive this shot. So they're seeing, if you're going to have certain adverse reactions, you're probably going to have a greater chance of having them if you're younger than if you're older. That's one. Another is the adverse reactions seem to be stronger with the second dose than the first, statistically speaking. So if your first dose went very well, your second dose might be a little more challenging.
Mm-hmm.
If your first dose was really challenging, your second dose, you may want to be sure to get that dose at a facility that has the ability to handle things like anaphylactic shock, for example, just to make sure that you're safe. Another is that if you have already had COVID-19, you're more likely to have adverse reactions when you take the immunizations. So these are things to consider. Mm-hmm. Everybody has their own individual history, their own individual health conditions, and so each person really needs to continue to be free to make that decision on their own. We should never reach a point where the government is going to mandate that everybody has to take this vaccine.
Right.
And I'm not even comfortable with the mandates that I'm hearing right now about foreign travel, where somehow the ability to travel to and from foreign countries is going to be related to your ability to produce a certificate showing you've had the vaccines. With everything we've just talked about,
right,
why should we mandate? If it's not necessarily going to keep you from getting it or
Correct.
keep you from spreading it, what's the difference when
exactly.
you're traveling?
And if you've had one vaccine and there's other strains that are in other places, and you go there, you're not protected anyway.
We just don't know. You may or may not be, and we just don't know yet. So,
well, we can ask our government how to respect our personal freedoms, but it'd be hard to ask a foreign government. But then again, this is in years to come that we have to be aware of what's happening.
Right.
So that way we can, not only protect our freedoms here, but be able to travel later, I guess.
Yep.
That's right. Well, Beryl, is there any other thing you want to add into the conversation before we?
I just want to encourage people to make all of their decisions after doing individual research for your own particular circumstance or that of your loved ones that you're responsible for. If you don't feel you have enough information, don't act. Wait until you get more information. If your doctor is one that you trust, then ask your doctor to help you to find good, solid, reputable data that you need to make an informed decision. We don't want anyone to make a decision lightly or to make a decision simply out of fear without knowing what the actual risks are. So take your time, ask the questions, do the research, and just don't take any steps unless you are comfortable with them. And please don't hold it against anyone else if they make a decision that's different from yours, whether it be about masks, whether it be about taking shots or going out in public, frequenting a business, and also be kind to the business owners.
Yeah.
I don't like wearing a mask. I don't personally believe that it's terribly effective, but out of respect for our business owners who are just trying to make a living,
right.
I will gladly wear a mask while I'm in their facility if they are requiring it. And also, I understand with the enormous amount of information that's come out through mainstream media, and I know that much of it has been to cause people to have enough fear to go out and get the vaccine, and that was done on purpose. I really respect those that I come in contact with or that I'm passing by in public. When they have that fearful look in their eyes, I will gladly put on a mask so that they don't have to be feeling as if they're in any danger
right.
by me passing by them in the grocery store.
It's also a way to
aisle.
respect their personal freedoms.
Right.
Right. Sometimes respecting somebody else's personal freedoms is that you don't agree with is, not to give up your own beliefs, but to simply just respect theirs.
Right.
And I agree with that. That's what people say. Why do you wear a mask sometimes? Well, sometimes I'm in an area where I just know that people need to be more comfortable that more people are wearing one and
right.
and do that.
Yeah.
And I like the fact that you pointed out that this is about, somebody's personal choice. That whether, that's for somebody, you're not advocating mask, no mask, you're not advocating, vaccine or no vaccine. You're advocating people, personal responsibility and doing their own research and finding places. But I also like that you have offered information, where people can go to get that information.
Yes, I try and help. If people really, really need to go and get this shot so that they feel that they can live in peace, then I'm happy to let them know where it may be available. It's difficult right now. I know that there is much less supply than there is demand. I know that the waiting list can be long. I know that it can be very difficult to get on some of the waiting lists at certain pharmacies or other facilities, especially when they're not taking any names by phone and they want you to go to their website.
Right.
And, that can be challenging sometimes.
Exactly. They put you on a list.
Yes, they put you on a list. So I know it's difficult, but if somebody desires to get this shot, then I'm happy to direct them to the best I can as to where it's available in the community.
But now, on the other side, do you have information if somebody asks you where to go to get other information that they may need to make their own decision?
I don't have it put up like on my website personally, but maybe that's a good idea. Maybe I should start posting some things.
Maybe, but just so you know it's out there, the information is out there.
Yes.
Beryl, thank you so much. I appreciate it. Appreciate your time.
Sure.
Out here today. And thank you everybody for tuning in to us today. Please share the video, like it. And you can, if you want to listen to the audio version, it's going to be on my podcast. And remember, it's William Wallis for America. It's WALLIS. And hopefully this video has been informative and you can share it with some other people to be able to inform them and allow them to make their own decisions. And in the meantime, thank you very much. And always tune into my site, William Wallis for America, on Facebook, my podcast, and also on WGSO 990 AM in the New Orleans area. Thank you very much, guys, and have a great day.